You are welcome to my channel. Today I'll be going through signs and symptoms of COVID-19. By way of introduction, there are no specific signs and symptoms when it comes to COVID-19. The best way to know that someone is down with COVID-19 is to first of all screen, and if the screening is positive, which is not going to be specific, then have COVID-19 testing done, and that will give the definitive diagnosis. Why that? Some that will screen negative might actually have the virus, while some that will screen positive may not have the virus. So screening is just for the moment. The real definitive diagnosis is COVID-19 testing. CT scan will give ground glass opacity, but that is not found only in COVID-19. Now, when it comes to the signs and symptoms proper, some will be asymptomatic. I'll go into details in a bit. And to those that will be symptomatic might be mild. Some might be severe, might be critical in some patients, and might end up as fatal cases, that is, death. If it's not ending up in death, they will recover. And then some that will recover will go into prolonged symptoms, or they become long haulers. And of course, there'll be certain complications. Now, COVID testing. Both clinical and laboratory diagnosis will help. Screening will guide us by who seems to appear to be having symptoms or not. That is not diagnostic in any shape or form. The testing proper for the COVID-19 testing for SARS-CoV-2 is the definitive diagnosis proper. Now, the asymptomatic patients. About half of all individuals in the world who would have contracted COVID-19 will not have symptoms. And this will occur across all age groups. In other words, asymptomatic patients will not be only elderly or young adults or children, will occur in all age groups. The asymptomatic individual has acquired the causative virus known as SARS-CoV-2, but he or she is not showing any sign and no symptom at all. They will, however, test positive if you test them for SARS-CoV-2, which is responsible for COVID-19. And sadly enough, they are capable of spreading it, though they are not symptomatic. That is why preventive measures will help with your face mask, hand washing, and social distancing. Now, still on asymptomatic patients, how can you prevent yourself from contracting it because they are not showing symptoms? Then the best thing is continue with your face mask if you have not taken your vaccine. Continue with your hand washing. Avoid enclosure with non-masked friends and acquaintances, and even those that you don't know. Let the physical and social distancing continue. No loud speaking and people around, or you standing close to someone that is pretty loud, or group singing should be banned unless there is vaccination already done. Because some in the past were having, choir practice, and they were singing loud, they were practicing loud, they were in one room. No one had symptoms, so nobody deliberately, chose them to infect the rest, but the affected person was asymptomatic, and some other members of the choir group came down with the disease. So, group singing can be a source of spread. Still asymptomatic. When elderly people are asymptomatic, that is for the moment in majority of them. And why that? About 80% of elderly people that are asymptomatic today will eventually become symptomatic after. And some asymptomatic patients will have atypical imaging on CT. Remember, I've just said, CT will give ground glass opacity, which is not found only in COVID-19. Some will have CT radiological features like the ground glass opacity, but they will not show symptoms. Okay. Few with non-specific symptoms will present with vague, mild fever. Okay, still on asymptomatic patient, some will be wondering why the emphasis on the asymptomatic patient this much. The reason is that they can easily spread it and you won't know it. Okay, and they don't know either that they are spreading it. Okay, you can get to know them through contact tracing, and some parts of the world, the government have developed some apps to help people trace whoever they've contacted who had COVID-19. You can't know them unless you have the COVID testing done. Some of them will actually develop a palsy, but when they do, they are lucky enough to have full recovery in most of the cases. We can conclude then that the asymptomatic COVID-19 patients are just buying time, meaning they are having delayed onset, because some of them will eventually come down with symptoms, particularly in elderly, or they are able to resist the virus, but they will continue to spread it, just like those ones that are fully symptomatic can do. Now, those who will be symptomatic. When they have symptoms might be mild, severe, critical, fatal, meaning will lead to death. And if it's not leading to death, it means it will lead to recovery. And part of those who will have recovery, some will not have full recovery, some will have persistent symptoms for a long time, the long haulers. And of course, there will be certain complications. Now, there are lots of factors that could aggravate the signs and symptoms, one of which will be age. It is known that elderly people will suffer the more. But this is not ruling the fact out that the younger ones down with COVID-19 will be completely out of the wood. No. But the symptoms will be more severe and leading to death in more elderly compared to the younger age groups. Diabetes mellitus, pregnancy could worsen the situation. Other factors that may aggravate the signs and symptoms will be respiratory diseases like asthma, chronic obstructive pulmonary disease, cystic fibrosis, or pulmonary fibrosis. Still on factors that could aggravate the signs and symptoms will be lifestyle, smoking, sedentary lifestyle, obesity, or overweight. Still on factors that could aggravate the signs and symptoms, because I need to go over this. This is the reason why some particular groups in a particular state or health jurisdiction will be known to be dying, due to COVID more than the rest because certain diseases, certain comorbidities are not found in those that are sick and walking around, but they are found in those that are down and dying. So another factor that could aggravate the signs and symptoms of COVID-19 would be heart-related diseases like heart attack, myocardial infarction, hypertension, cardiomyopathy, or heart failure. Still, on factors that could aggravate this would be hematological conditions like sickle cell disease, thalassemia, chronic illness like chronic kidney disease, liver disease, or dementia. Still on aggravating factors, immunosuppressant or immunocompromised status. HIV, I put HIV here, but that is not proven yet that having HIV will make COVID-19 worse. But when immunity is down, of course, the likelihood of HIV, having deeper root in affected person is higher. Corticosteroid use, cancer chemotherapy, neutropenic state, or hematopoietic cell transplantation or solid organ transplantation. All these factors here will give us the clue why some units in the hospital, particularly oncology, will take extra precautions. They don't allow anything around their patients. Why that? They are caring people. They know that their patient cannot take the risk of having COVID-19. Now, when we have gone through some of those comorbidities as per conditions that could aggravate signs and symptoms of COVID-19, then the patient is right here, tested and is already positive, and now we want to head to the lab to know how serious this situation is. Then we have complete blood count down. If there's anemia, then we're in trouble. If there's increased D-dimer, we're in trouble. Increased D-dimer is telling us that a clot formed, which COVID-19 could be responsible for, and more importantly, when D-dimer is present in anyone diagnosed with COVID-19, that is a pointer that this patient may not go home. Get it right. This patient may not go home, meaning fertility is higher in COVID-19 patients with D-dimer. When we do see reactive protein and it is high, we're in trouble. Increased CPK or increased lactase dehydrogenase is pointing to a bad situation, right? Also, increased ferritin, increased troponin, increased procalcitonin. Check my channel for that. I have full presentation on that, pointing to bacterial infection or virus. Increased BMP, pointing to heart failure. Increased interleukin-6 or increased tumor necrosis factor alpha, pointing to inflammatory process going on. All these are not what we want to see. They are pointing to more trouble at hand. Still back from the lab, and we'll find increased ALP, increased AST, might be pointing to liver, might not be the liver, but we don't want this to be high, right? And increased PT is telling us there's bleeding somewhere. Increased triglyceride or increased neutrophils are not telling us anything that is encouraging. That is bad. Now, finally, from the laboratory reports in patients with COVID-19, when we've already tested and we pick decreased lymphocytes, decreased platelets, and decreased albumin, oh boy, we're in trouble. This is a serious case. Now, Jim, I'm not saying here, quote me right, I'm not saying here that COVID-19 is a genetic problem. No. But some literature revealed that blood group A will lead to higher risk of signs and symptoms when SARS-CoV-2 is acquired, that is COVID-19 causative virus is acquired. But there will be lower risk if the patient is having blood group O. Now, to those who will have signs and symptoms, the most common ones will be cough, myalgia, headache, and sometimes with fatigue. Some will not have fatigue, but majority will have cough, body pains, and headache. Other sign or symptom will be anosmia, that is loss of sense of smell. They can't smell anymore and they will tell it. Dysgeusia or parageusia means they have bad taste. Now, someone who's a good cook before, now someone is cooking close to her, she can't even tell. And then you give the food and say, no, I can't even, I'm not enjoying this. So they don't appreciate the taste anymore. Then, they're done. Conjunctivitis, rhinorrhea, sneezing, cough, fatigue. Still, all these are not specific to COVID-19. Now, there may be confusion, nausea, vomiting, diarrhea, or sore throat. Though not specific, but when you have tested and the person is already COVID-19 positive and you pick all this, is likely from the virus itself. When pneumonia are setting, you pick rigors and chills. There will be abdominal pain, but I will tell you more why that may be. Physical examination might reveal hepatomegaly. Arrhythmia, hypotension, and shock might be responsible for why many of them would die, particularly in intensive care unit. Multiple organ failure will be the cause of death in them. Now, pneumonia. When pneumonia are setting, there will be fever, chills, rigor, cough, dyspnea, tachypnea, and so on. Then the chest X-ray is taken, or CT scan is done. Then you have ground glass opacity bilaterally. Neuro complications can occur in COVID-19 infection. Ataxia, seizures, encephalopathy, or stroke. Meningoencephalitis, movement disorder, motor deficit, sensory deficit, and Guillain-Barré syndrome within the first 1 to 2 weeks post-infection. Persistent symptoms here will include cognitive impairment, can't think straight anymore, cough, fatigue, dyspnea, chest pain, and persistent fever. In children, all these symptoms might be present but relatively less common. And when they are present at all, most of the time, the symptoms will be mild. But in few cases, when it comes to children, they can have severe signs and symptoms, and few children have died. Other symptoms that we can pick will be swollen hands, swollen feet, lymphadenopathy, rashes, tachypnea, or hepatitis. Now, I promised the other time that I will explain why anyone with COVID-19 could come down with abdominal pain. That could be as a result of ascites or mesenteric infarct, mesenteric inflammation, terminal ileitis, mesenteric adenitis, mesenteric adenopathy, or polycystic edema. The psychiatric ward is not exempted from the trouble from COVID-19. People with COVID-19 can come down with post-traumatic stress disorder, impaired memory, remember cognitive impairment already the other time, poor concentration. Some will become anxious. Am I dying right now? And some will become depressed. There's a timeline. And someone is asking me, how do you mean by timeline? Mild cases, within 2 weeks, we have full resolution in about 80% of them. But severe, critical, or fatal cases, that is, those who have serious cases admitted into the intensive care unit and end up dying or recovering, will have that all within 3 to 6 weeks, and it can be greater. Then those who will recover, either mild, severe, critical cases, will have recovery stage reached between 2 weeks to 2 months, and sometimes could be greater. The long haulers, those who have persistent symptoms, will have that for about 1 to 3 months, and it's going to be in about 10% of affected people. The long haulers will either have mild symptoms, and some will actually have severe symptoms. And they might be in those who have mild cases or those who have severe cases. But there is no consideration for either the fact that they've been hospitalized before or not. So it's not because Mr. A had COVID and was hospitalized in the hospital, that is why he has become a long hauler now. No. And it's not because of a particular age. It could be found in elderly, it could be found in the young. And there's no consideration for comorbidity or morbidity. So it's not because, he has become a long hauler because he has diabetes mellitus. No, that doesn't mean. The long haulers will likely come down with cough, chest tightness, shortness of breath, headache, body pain, diarrhea, or fatigue. Do we have any way out? And lastly, my energy will be invested in that. That is preventive measures should be fully observed. Okay? Then testing should continue where vaccination is not ongoing. Okay? Anyone affected should have treatment done. Please present an appropriate causes and have yourself treated. And finally, vaccination. Right in the tunnel, but at the end there is a light, no? And that is the vaccination. Prevention and resolution of long haulers will actually all be embedded in vaccination. And someone is asking me, how do you mean? Even the long haulers, those who have been vaccinated have been testifying that they are getting better after vaccination. So why not? Why not have any? And those who have never come down with COVID-19 don't want to come down with it, and vaccination is the best option. So either Pfizer, Moderna, AstraZeneca, or Johnson & Johnson, just get one. Please get one. Save yourself, save your friends, save your family members, save human race. Get vaccinated. With that, I've come to the end of this presentation as per signs and symptoms of COVID-19. The light now at the end of this tunnel is the availability of vaccine. Get it, save yourself, save human race. Thanks for listening. Remember to share this presentation. Remember to subscribe to my channel. I appreciate it.